Start to put your life back in balance with pulsatile insulin therapy.
My eyes are better. I have no gastroparesis anymore, thank the good Lord. It's just, this program is the world to me.
But I totally believe that the treatment saved the toe, because it would never have healed otherwise, because it simply didn't change for months and months and months.
I was hospitalized 22 times, so it was like an average of once a month I was going into the hospital with high sugars, flattened out with low pressure, low pressure flats, stuff like that. But congestive heart failure, all due to my diabetes. The diabetes was the leading force behind, that was causing the congestive heart failure and everything else, water retention, all of that kind of stuff. So since I've been down here and since I've been under treatment, I've only been in the hospital once.
Just like these folks, you now have the opportunity to put your life back in balance with pulsatile insulin therapy, also known as metabolic activation therapy. This patented intensive insulin and carbohydrate therapy is administered weekly in an outpatient setting to relieve the most significant complications of type 1 and type 2 diabetes. Pulsatile insulin therapy is an outgrowth of 25 years of research, beginning with the groundbreaking work by Dr. Thomas Aoki, former head of the metabolism section at Joslin Diabetes Center in Boston and now professor of medicine at the University of California, Davis. Dr. Aoki theorized that organ damage in diabetes is caused by abnormal glucose metabolism, inadequate insulin delivery, and insulin resistance. Further research at such prestigious institutions as the Mayo Clinic, Scripps Clinic, Summit Medical Center of Nashville, University of Arizona, University of Maryland shows that this is the only therapy known to actually stop the continuing decline and, in many cases, reverse some of the debilitating complications seen with diabetes. The basic idea behind pulsatile insulin therapy is simple. The treatments are intended to make the metabolism of a diabetic person's body mimic the metabolism of a healthy body.
What MAT therapy does is it rapidly raises the levels of insulin in the blood, which quickly get to the liver, and help to improve the liver's ability to utilize the circulating glucose or blood sugar. We're turning on, it's sort of like flipping the switch on. Think of it like a dimmer switch. And in a diabetic, the dimmer switch is way down on the liver. We're raising that dimmer switch so it's bright, you can see what's going on. And IV insulin, pulsatile, will do that. And the way in which we know that it's working is the respiratory quotient, or RQ, goes up, meaning that the body is becoming more efficient and utilizing glucose or blood sugar in the proper fashion, as a person without diabetes does.
Over 40,000 treatments have been performed with tremendous success. They last for 6 hours, and here's what you can expect. First, your vital signs and initial glucose levels are checked, and the doctor will review your medications and your overall condition. Then an intravenous line is established and your treatment commences, sending insulin at predetermined levels directly into your system. Before and during each of your sessions, you will be given an oral carbohydrate to consume. The first course lasts an hour, then you rest for an hour, and that process is repeated 2 more times. Patients on the treatment have experienced some amazing improvements in their symptoms and their overall health and energy level.
Since I've been here, I don't have to have glasses to read. Feeling back in my legs, so I'm doing great.
I eventually lost the vision in this right eye. I had 2 detached retinas and 3 cornea transplants trying to save my vision. And after getting on this program, I'm now getting my vision back in the right eye. I'm starting to get feeling back in my feet and from my knees down, in essence. First treatment, next morning in the shower, I could feel the hot water. It was really hot, but before I thought it was warm.
I honestly do feel that the program has helped me tremendously. And I also want to point out to anyone that you develop a closeness with your doctor that no one could ever have in any other aspect. You see the doctor once a week. You know, the doctor comes to the clinic once a week to see you. And, I mean, how close could you get, you know, to a doctor? I mean, you know, and he knows everything about you. He knows your little changes, big changes, what happened this week, what, you know, and you can't give that up. You can't get that anywhere.
We have seen patients that have showed a lack of progression of complications, including their retinopathy, which is the bleeding in the eyes. It seems to also involve an improvement in gastroparesis, which is this deregulated emptying of the stomach. It tends to also improve the sensation of hypoglycemia. Some of these patients with far advanced diabetes have lost the capacity to recognize a hypoglycemic event.
Ordinarily, when you get hypoglycemic, you get kind of sweaty and weak and things like that. I would just fall out. I would just collapse. I would go to Publix and pass out in Publix. The people in Publix were like, oh, please don't come to me on my shift. Or if I didn't come for a couple of days, they'd go, oh, we were worried sick about you, you know. And it's kind of embarrassing to have the paramedics know you by name, you know, and say, oh, I was at her house yesterday, you know. It was one time I had the paramedics at my house 4 times in 1 week. Since I've been coming to the treatment and have been here almost a year, I have found that I am better able to recognize my lows when I get them. Where in the past, I had been, like I said, I've been in the hospital at least twice a month, and that is not an exaggeration. That's probably, I was probably in there more than that. But I've only been in the hospital 1 time since I've started this treatment. And the paramedics have forgotten my name, and I find that, you know, pretty good.
We do see some patients that have improvements in metabolic control overall. That includes not only stabilization of their blood sugar levels, that also involves stabilization of their cholesterol, their lipid profiles. We are trying to conduct studies to look into perhaps stabilization of heart disease, the typical arteriosclerotic heart disease that diabetics tend to suffer from. We feel that there may be some evidence that we could potentially arrest the progression of heart disease.
And these ongoing studies that we talked about, I'm looking forward to seeing the results of that, because we know the #1 killer of patients with diabetes is heart attack and stroke. It's cardiovascular disease. Now, we know that's the #1 killer of everyone, even though there's those that don't have diabetes. The problem with diabetes, it happens 20 years sooner than it should happen. It's like diabetes prematurely ages your body. So you die of heart attack just like everyone else. Instead of dying at age 80, you die at age 60 of the same thing. So if we can slow this hardening of the arteries, this cardiovascular breakdown that happens, we can save lives.
The first of many questions you may have is simply, are you a good candidate for the treatment? If you suffer from type 1 or type 2 diabetes and have any of the debilitating complications associated with it, and have not seen relief and perhaps even decline despite standard care of treatment provided by your endocrinologist, then you may be a candidate. This is an important decision and must be made in consultation with your endocrinologist. Metabolic activation therapy is indicated for patients who, despite their best efforts, continue to experience unanticipated large swings in blood glucose levels, resulting in frequent episodes of hypoglycemia, hyperglycemia. It is indicated in patients requiring frequent hospitalization due to diabetic ketoacidosis. It's indicated in patients suffering from frequent severe hypoglycemic episodes with hypoglycemic unawareness. MAT is indicated when, despite intensive oral hypoglycemic agent and/or insulin therapy and blood pressure control with ACE inhibitors, the patient's renal function continues to decline. MAT is indicated when the patient with diabetes has orthostatic hypotension, not treatable by other therapies. MAT is indicated for patients with gastroparesis associated with diabetes not relieved by other drug or dietary therapies. Metabolic activation is indicated for patients with painful peripheral neuropathy, not relieved by conventional state-of-the-art intensive therapy and/or analgesics, as well as patients with background or proliferative retinopathy. Metabolic activation is indicated for treatment of non-gangrenous, non-healing leg ulcers not complicated by osteomyelitis and not responsive to other therapies. This list of indications is sure to expand as ongoing research, supported by ADTC, learns more about the effectiveness of MAT in restoring a healthy metabolism. How often do you need to be treated? Pulsatile insulin therapy is performed on a weekly basis. The treatment sessions last approximately 6 hours. Our centers are designed to maximize patient comfort during treatment. Does insurance cover treatments? Like any new treatment, insurance company policies will vary. We have an excellent benefits department who will work with your insurance company to minimize out-of-pocket costs. They will determine any copays and deductibles required. Do you still need to take your regular insulin dose? Patients on pulsatile insulin therapy still need to adhere to their daily insulin regimen. Many patients do find that their insulin needs are less and their blood sugar levels are more stable. What other positive benefits might you experience? Commonly, patients report an increased energy level and an overall improved sense of well-being. What if I go on vacation and miss my activation session? Missing 1 week of treatment does not result in any loss of the effect of pulsatile insulin therapy. Most patients will, however, notice the deleterious effects if they miss their treatments for more than 2 weeks. Admission into the ADTC program begins with a thorough consultation with your endocrinologist. He or she will discuss with you your individual situation and whether or not you are a candidate for pulsatile insulin therapy. If you do not have an endocrinologist but feel that you might qualify for this treatment, please call our toll-free number, 866-423-8230. And the ADTC referral service will help you locate an endocrinologist in your area. Or go to our website, www.adtcusa.com, and start to bring your life back in balance with pulsatile insulin therapy.